My name is Amal Nergadkar. I'm the CEO of Patient Prism, and I'm having hygiene conversations with none other than Rachel Wall from Inspired Hygiene, who is one of the best hygiene coaches and consultants in the country.
Thanks, Amal.
Dr. Bicuspid named her actually one of the most effective dental educator in America. She speaks all over the nation at conferences, helps dental practices really optimize the hygiene departments to produce their best potential.
Yep.
So the question directly is at the heart of this, is what are three ways hygienists can increase their production?
Yeah. So the most obvious, Amal, is to increase the level of services, right? It's hard for a hygiene department to be at their maximum potential if all they're doing are prophies and x-rays all day long, right?
Sure.
Now, they could be producing, right, if you're seeing a lot of patients in a small amount of time,
Right.
but might not be real profitable, because what happens then is often the diagnostics fall away.
Sure.
So increasing the level of services, allowing the hygienist the time to really work with the dentist to make the diagnosis for periodontal therapy, for restorative treatment, for adjuncts that the hygienist can provide to the patient.
Sure.
That will be beneficial and also increase production.
Sure.
Second thing is reducing open time. And you and I have talked, there are a million ways to help reduce open time, whether it's a problem with cancellations, no-shows, or the appointments just aren't getting filled, right? Maybe there's not enough patient flow yet to fill the hygienist schedule. But a couple of things that the hygienist can do is, when they're making that next visit, and I really believe that the hygienists are the most effective at building the value for the patients for the next visit.
Sure.
When they're making that next visit, sharing with the patient, okay, and the next time I see you, here's what we're going to be checking on. When the hygienist does have downtime, calling patients. Patients that they have relationships with especially, and really just engaging them and letting them know that the practice is concerned and that we want to find a time that's convenient to see them.
Okay.
I think reducing open time is understanding, when it's appropriate to reschedule the patient, when it's appropriate not to reschedule a patient.
Sure.
So reducing open time obviously will increase production. And then starting on time and staying on time. Patients are way more likely to refer their friends and family if they don't have to wait.
Right.
And it's not easy, right? Hygienists have a lot to do in a short period of time.
Sure.
So really figuring out, what do I need to accomplish during this visit? How can I call the doctor early for the exam so that we're not rushing and every one of our visits is rolling over into the next? So those are just three things that can be done.
Going back to number one, which is increasing the level of services, does that entail that the hygienist needs to be educated and feel confident in detecting and feel confident in their diagnosis?
100%.
That there's, the pockets are big and you have periodontal disease and these are the things. So how important is training the hygienist to feel confident? They know it, but sometimes they don't feel confident enough to tell the patient that, oh my God, the bleeding is really bad and you need therapy.
Yeah, it's critical, and the hygienist has to believe that treatment is in the patient's best interest.
Sure.
So yes, it's critical for the hygienist to feel empowered, to feel confident, to believe in the treatment that he or she is presenting, for that to be effective, and for the patients to say yes.
I always wonder that, the ADA, and your book says this really well, the ADA says 47% of US adults have periodontal disease, and then maybe it's like 70% of people over 65.
Right.
So why wouldn't you want what's best for the patient, which also actually increases production?
Yeah, I think that a lot of times practices just have obstacles and they don't know how to overcome them, and it could be something as simple as they don't have time in the schedule for any other treatment. So there are practices that are maxed out in their hygiene schedule.
Sure.
And sometimes they have the space in their facility to add another hygienist, but they're not sure if they can fill it right away.
Sure.
And we help them grow into that. And so I've seen it time and time again with well-established long-term practices that they say, hey, we've wanted to do this, but we honestly don't have anywhere on the schedule to put this treatment. So it could be that. It could be that they're confused by the codes and they don't know the sequence of the treatment to provide. And if I see the patient today and they have localized periodontal disease, can I do the prophy today or not? So
Sure.
a lot of times it's confusion which keeps them from moving forward. Sometimes there's multiple hygienists and they're all doing something a different way.
Sure.
And that can create frustration for everybody in the team. Good intentions, but we just don't have a clear system.
Sure.
And so there's a myriad of obstacles and reasons why they might not be at their potential there.
And then in terms of the second factor, which is reducing open time, what percentage is the right percentage? I mean, if there is one.
Yeah, so we like to see 8%, 8 to 10% or less. I will tell you though, it's interesting is when we see practices like those that I mentioned
Sure.
that are at 3 or 4% open time, they don't really have room to grow.
Interesting, okay.
So they're so tight that it does a good thing because it creates that exclusiveness with the patient, right? They know, hey, if I cancel my appointment, I'm not going to be able to get in.
Right.
However, they don't have a lot of room to grow, so often they're not hitting their new patient numbers, and they're certainly not hitting their desired perio percentage because there's no room to put it. So there's a sweet spot there. And we actually like, when we go into a practice and we see that the perio percentage is lower than what they like, and they do have some open time, maybe they've got
an opportunity there.
Yeah, there's a great opportunity there
Absolutely.
because they actually have space for those people.
And in terms of staying on time, we've said that now obviously patients nobody has time these days, right? They're there for the appointment, they want to get out. But how important it is for the hygienist to manage the time that they have the patient for an hour. How important is that? Right, that's also important, correct?
Yes, it is important. A lot of times we see, especially in practices that maybe don't have a clear system for treating periodontal disease, the hygienist spending way too much time on the scaling because they're feeling like they have to treat this disease in a prophy. So other things get left out, the diagnostics get left out, and then that tends to cause them to run behind. And then it's not fun to work that way.
Right.
So the hygienists get burnt out.
No, there's so many complexities to this, right? I mean, the three factors, I love them, that you've got to increase your level of services, you've got to reduce the open time you have, but not too much, right? And then you have to stay on time, be on time, so that the patients are happy and they're referring other people. So these are great points. Thank you so much for discussing them. Thank you.
Thank you.